Bismillah ar-Rahman ar-Rahim. We are going to discuss ethical issues at the start of life. Reproductive issues. Assisted reproduction is permitted as long as it is between legally wed husband and wife. Entrance of any third parties in the reproductive function is considered unethical and is haram, is not allowed by the Sharia. Contraception is allowed. It is one of the things that are mubah for various reasons. The restriction is that we shouldn't use a contraceptive method that involves destruction of life. There are methods that are reversible and irreversible. In general, we want to use reversible methods. So there are reversible methods for males and reversible methods for females. Permanent sterilization, which involves a permanent destruction of the reproductive function, is frowned upon. Abortion can be carried out in a situation in which continuation of the pregnancy will harm irretrievably the life of the mother. Now here I need to explain. We carry out the abortion not because the life of the mother is more important than the life of the baby. It's for a different reason altogether. If we do not carry out the abortion in a severely ill mother, the mother may die. But if the mother dies, the baby also will die. So we're going to lose two people. But when we carry out the abortion, at least we save one of the two people. So it's a mathematical issue of saving one life and not losing two lives. Gender selection is a serious ethical issue because it interferes with the Sunanullah. It interferes with the laws of Allah in nature. And in many places and societies that practice gender selection, we are beginning to see a lot of undesirable side effects. So we have to be very careful about gender selection procedures. Many of them run into the area of being unethical. Gender correction or gender change operations are allowed to correct gender to the natural or the correct one. For people who have got confused gender, correction using hormones and using surgery is allowed. But it is not allowed to change gender for the sake of changing gender. That one is not allowed. We only allow it if there is a confusion, and through examination involving chromosomal analysis, we realize that the true gender of this person is male. So we can carry out an operation to turn that person into a male. Or if the true gender is female, we can carry out an operation to turn that person into a female. Menopause may require use of hormones. Now we need to balance the advantages of using hormones, hormonal replacement therapy, and the possible side effects of causing cancer and cardiovascular diseases. Oncofertility is a new area that is growing. Sometimes we may need to use chemotherapy, radiotherapy to treat people with cancer. Now, chemotherapy or radiotherapy will destroy the semen in the man, also will destroy the ova in the woman. It is allowed to remove the ova and the semen, store it in a freezer during the period of the treatment, and after the treatment is over, those people can have a chance to reproduce using assisted reproduction. Now we shall discuss case scenarios involving reproductive issues. Next. This is case scenario number 1. Case scenario number 2. Case scenario number 3. Case scenario number 4. Case scenario number 5. Case scenario number 6. Case scenario number 7. Now, there are ethical issues in artificial reproduction. In vivo insemination is permitted. As I said, it's part of assisted reproduction as long as it is between husband and wife, no third party. In vitro fertilization is allowed to treat infertility. Again, no third parties. Only a husband and wife can be part of this in vitro fertilization. It's not allowed to donate eggs, to donate semen, or to use surrogate motherhood according to the teachings of the jurists. But in case people do violate the rules about in vitro fertilization, there could be cases of disputed parenthood between the biological mother, for example, and the surrogate mother. In such cases, we give priority to the biological mother, but the surrogate mother could also have some rights of parenthood, like a foster mother in the Sharia has got some rights of parenthood. Now, freezing sperms, ova, and embryos have been allowed with caution by the jurists because the possible problems, including misuse, could occur. Now, pre-implantation genetic diagnosis is a problem. In the in vitro fertilization procedures, several gametes may be fertilized, and these are potential human beings. And the parents may want to carry out genetic analysis, genetic diagnosis to see if they have got certain congenital diseases and abnormalities. The problem is that such diagnosis may result in destruction of life. So this is an issue that we need to discuss very seriously, because the second purpose of the Sharia is hifdh al-nafs, protection of life. Selective fetal reduction is resorted to in a case when the mother has got 3, 4, or 5 fetuses, and the chances of them being born alive are low. So selective fetal reduction means reducing the number to 2, so that those 2 can have a chance of surviving instead of all the 5 of them being aborted because of problems related to multiple pregnancy. Now we will look at some cases. There are also ethical issues in artificial reproduction. Many of them are not allowed. We cannot develop embryos for non-IVF purposes. Using embryos for cloning is a problem, and a serious ethical problem that the jurists are still discussing. We cannot mix gametes or embryos of different parents. It confuses lineage. The biggest fear we have is that as artificial reproduction expands, people may start engaging in illegal commercial trading in gametes and embryos. Now, an issue may arise when parents, when let's say the mother may ask for the semen of a dead husband to carry out an IVF procedure. The teaching of the scholars is that we cannot allow post-mortem insemination or in vitro fertilization, because the law requires that a child is conceived when there is legal wedlock between the 2 parents. In case of death, that legal wedlock has ended, and it wouldn't be permissible to have a baby. Okay. Now, there are issues in teenagers that confront us. Teenagers may have problems and they come to doctors, but teenagers are still minors. It means the doctor must inform the parents what is going on with the teenagers. But if we inform the parents, the teenagers will not come for treatment, and maybe their disease conditions may become serious. In Britain, they dealt with this issue using the Gillick competence law that allows teenagers to go to doctors and get treatment for certain conditions without parental decisions. In our society, this is difficult to apply because parental authority needs to be respected. But we shall discuss actual cases as we need to know that in ethics it's not black and white. There are always many gray areas that need discussion. Now, again in Britain they have got the Fraser criteria. It again has to do with the limitation of parental authority when teenagers go to doctors. As I said before, many of these things maybe are not applicable in our Muslim societies. Now we look at certain case scenarios about teenage problems and confidentiality and parental roles. This is case scenario number 1. Case scenario number 2. Case scenario number 3. Thank you very much.